There we go. How we doing?
Hey, how's it going, everybody?
Happy Friday. Hope everybody's doing well. Thank you so much for joining us. If you are watching live, comment live, please. If you are watching on, let's say, a replay later, just give us a comment on the replay so I kind of know, we want to know who's watching and who's getting value from this. So, as we talked about, I put a little title up there, rib pain. If you're getting pain, like we had a couple people in the last few weeks with this, where it's like either pain in here or even kind of, it could even be in the back, like flank pain through here or into the rib. So now the most common cause, if you had some kind of, say, trauma. I mean, if you fell and something hit you on the ribs.
That makes sense.
Or pushed or pulled
like
something. Yeah. So first we have to rule out that, make sure you didn't, fracture or bruise the actual bone or rib or soft tissue around it. You could also kind of injure that costochondral joint, where the bone starts to, it transitions from bone to cartilage, where it comes into your sternum. So there's some joints right along here, costochondral joints, that can kind of get irritated. They can sublux or move, that kind of stuff. The other reason that we would have, and it kind of depends on the questions, or really the answers to the questions that we ask. What turns it on? How long have you had it? What makes you worse? What makes you better? Do you notice a loss of motion? Does it come on during the day, during the night? So certain things, and the last couple of people that we've seen has been more of a pain that either shoots like through you, or it wraps around and kind of like an electrical type, like it zings around the side. Well, you've got these little nerves that trace between the bones, in the space, like a little dorsal rami kind of root that just kind of travels along. And quite often we find that a problem in the mid-thoracic spine, so this is not as common, right? We see a lot of neck stuff, Jake, we see a lot of low back stuff. Because there's no ribs up here, there's no ribs down here. Much more easy to be damaged, more movement. Through the thoracic spine, your ribs connect, it's a much stronger area, so it's less of a chance for injury. But when it does happen, it's painful. It's painful. Yeah. So what have you found when you when you palpate and chiropractically, when you kind of move through here and you're like, oh, that turns my rib pain on? What do you kind of do from that point on?
So let me represent here.
Yeah, so you can look at the facets there and kind of see, that's a lumbar one. But
press on the back of the spine here. That's that bony prominence you can feel right coming straight out to you. Yep. So you can press on those and see if the thoracic spine is involved at all. But more often than not, if it's a true rib issue, pressing out on these transverse processes, these are where the rib would connect in the mid-back. Mm-hmm. If you press over that, you'll find tenderness, sharp pain, even like a shooting sensation, or it can even reproduce that wrapping sensation coming around.
And are you talking like just on, so you're talking like unilaterally pressing on one side?
Yeah, it's usually...
You get a little bit of rotation in there, and you gotta remember these things have this kind of this bucket handle type movement through here.
Yep.
And it makes the thoracic spine very stable. We need that rib cage to protect our innards, right? I mean, lungs and heart and all the stuff that's inside.
Yes, so it's usually one-sided. Very rarely is it ever on both sides, but you can usually reproduce it just with those movements. You can even, sometimes I'll have people, I'm going to have you face the other way here, Chris.
Yep. But Andrew just said hi to you.
Who's that, Andrew?
Yep,
What's up, Andrew?
Yep. Thank you for watching.
So I'll have people take a breath in and out as I feel how their ribs move. And there should be like a little bit, like Chris said, that bucket handle motion.
Kind of pivots a little bit.
Kind of flare just a little bit. But if it's inflamed and irritated, you may not feel that movement. So there's a joint capsule that surrounds where that transverse process connects to the rib. And in like a rib dysfunction, part of that tissue can get in that joint space and it can feel almost as if your rib has literally slipped out. Mm-hmm. It doesn't slip out. But if that piece of fold or that tissue gets in that joint space, that's what can cause that pain and that wrapping pain. Mm-hmm. So that's why it's tender to the touch.
It is its own joint. It's its own joint. Now the other part that we were talking about is if there's a soft tissue piece of occupier. So if there's a bit of a soft tissue occupier that hits the nerve root, so there could be a little bit of a nerve root. Let's focus that in a little bit. There we go. On that nerve root, then you can get the pain that wraps around the ribs and shoots you like right through the body. That's like, oh, sharp pain. And there's usually a loss of like, when you rotate, it hurts, it turns it on. Yep. When you side bend, it turns it on. You can move your arms and do stuff. And
back
and it really like, it shoots and it takes your breath away. It is a sharp pain. It can be like an arrow right through you, like through the chest or through the shoulder blade area.
Yep.
So it's usually not a fun feeling at all. And that's when people come in, and they'll usually go to, if they don't come see us first, they'll go to the doctor, okay? And then they'll say, well, it's not a, they'll check the lungs, they'll check the, okay, it's not broken, it's not any kind of like, other bad, red flag type thing, anything sinister like a cancer or anything else. So then, what does it usually fall into? It falls into the camp of mechanical pain.
Muscle and joint, yeah.
Whether it's a joint, a bone, a muscle, it's something mechanical because it changes with intensity, changes with position, with time of day, with movement, and though we can usually, right, through repeated movements, testing, and kind of figure out what's a solution that you can, of course, in combination of specific techniques, and then take something home with you for a movement or an exercise or a homework, something to do to help yourself, to take some accountability for this thing. So, okay, I know what to do with this. I know what better and worse looks like. I know what I should be doing. I'm not scared to turn it on a little bit because I know I'm not making myself worse. Yeah. So what would we usually use for that? We find, and Shay's had a low back one in the past, and he was able to get that pretty well resolved. So normally we look into thoracic rotation, flexion, and extension. So first, flex. Let's go through the like sit through your body and reach down between the legs to the end of the. So when you go here, you can see how much flexion he's getting through that thoracic spine. I'm going to rotate you just a little bit here, guys. There we go. So he's going to get a lot of flexion through here, and you can even pull on the chair to really load that. And if this turns that thing on, like bang, all the way to the side, okay, we know something's on there. We know something's happening in the spine. And then I'd probably even test. I'd lock down his legs, right? And then he'd be here, and then rotate to your left. And if he rotates into it, ooh, that gives my pain, or he's got a loss of motion. And then we'll go right, and we kind of test and see what that feels like and what losses there are. And then we'd go into extension, and I'd probably use a little bit of a fulcrum. He can either use the edge of the chair, or sometimes I'll use a half foam roll. And I can put it then right where his spot is. So right there, use the weight of the arms, and he's going to just kind of go backwards. And you got to use a little bit of momentum. So you got to kind of snap it a bit. Yeah, that way, because this is such a strong area and a very restricted area on a lot of people. There. So that's typically going to turn it on a little bit, where it's going to say, ooh, that kind of hurts, when he's back there. But then when he comes up, no, it's gone. So turns it on, turns it off. Now, is that a worsening, Jake? Is that a red light to turn it on and turn it off?
As long as the pain stops when you come back to this neutral position and it doesn't linger or increase in intensity for a period of time, then you're fine. Yep. Move on with it.
Yellow light. That's not wrong. I know it hurts to do it. So we tested those motion. We got a baseline, right? We need a concordant sign, something we can retest. We know that there's pain with rotation. We know there's pain and loss of motion with flexion. We pick a direction. In this case, we're going to go with extension. It turns it on. Ouch, that increases my pain. That hurts. But then when I stop, come back to here, no, it's gone. No worse. So keep going. Test. After that then, we're going to come back to the front of the chair. Yep, bend, and flex, test. Ooh, okay, that doesn't hurt as bad. And then I lock the hips down, and then, I can go farther and there's less pain. Well, then we know we're on the right track and we got the right movement. Now, it's not always extension.
No,
sometimes it's rotation.
Sometimes it is, yeah.
Sometimes it's side bending. Sometimes it's flexion. We're just giving you an example of what we typically see, and how can we take somebody through those movements. On a chiropractic side, talk about, so when we get going backwards this way, we're getting extension through those joints.
Yes.
So when Jake has somebody laying on a table face down, talk about, you talked about kind of on the side of the transverse process, when you get a good manipulation through that spot, either whether supine would come around or just posterior to anterior pressure, he's still creating an extension moment on those bones very similar to that. I'm just trying to give in addition a tool, something that's on the same lines as what the treatment is, that you can do at home, that you can reproduce on your own, because you can't reproduce the treatment at home. So
on our side, usually we'll grab the spine. An extension, at least for adjusting spinal manipulation, is the most effective movement. So I'll usually take my fist, I'll put myself on the back of your spine, and I will drop through there to create a quick extension motion, which that helps whatever's in the joint space shift, or it gaps the joint just enough to where that piece of tissue can move, and then free you up either at the joints themselves or the rib. And then you keep it moving. through that exercise that we just did, we'll find
if that's the direction, or it could be
rotation.
Be a quick rotation, snapping to the side.
Yep.
It could be a quick something like, or a combination of extension and rotation to really close that one side down. But you'll feel a difference in your. It's a cause and effect.
Yeah.
Hurts to do, maybe. But net result overall at the end, oh no, that doesn't hurt anymore. Now I feel better with my movements.
And
then it's right.
And these rib type issues usually respond very quickly.
Yeah.
So like one visit, you should
Yeah,
notice significant change.
This is kind of like an acute Rhineck type thing.
Yeah, it's
or
quick.
a BPPV with dizzy. Like we can usually change these very fast.
Very fast.
It
Yeah.
makes us look like geniuses, but it's because it does change so quick.
Yeah.
Which is a good thing, obviously, for the person suffering from this. So don't wait on these. I mean, will it go away eventually? Probably. I mean, but if you can speed it up and get back to doing, to movements and being active.
Well, they're usually
you'll
pretty
just speed
limiting
it up.
when they do happen too.
And it takes your breath away. It's a sharp,
it
sharp
definitely
pain.
takes your breath away. Yeah, I've had it before.
So that's the rib pain.
That's rib. Yeah, pretty easy.
Okay.
So, cool.
Thank
If
you
you're
for
having that,
those.
let us know.
Yeah, thank you for those that were watching today. Appreciate it, Andrew. Thank you very much. Have a great Friday. It was
Thank
great
you.
seeing you this morning. Shay, Jason.
Sweet. We got some good viewers.
Yep. Nikhil, thank you very much. Appreciate it, guys. Thumbs up. There we go.
Nice.
Appreciate it. And enjoy the weekend. We'll get back with you next week on anything that come. As things come in, as we get questions, as people try to ask us, what happened here? Why am I having this? Why am I having this problem? We'll try to
we'll answer it.
inform you as well as to what these common issues are happening. So.
Cool. See you guys.